Hello, my name is Fatima Adnan, and today I will be presenting my descriptive epidemiology project on depression among U.S. adults. In this presentation, I will explain why depression is an important public health issue and then go over the person, place, and time patterns that describe it. So, depression is one of the most common mental health conditions in the United States. It affects how people feel, think, and function in a daily life. According to the National Health Interview Survey, about 21.4% of the U.S. adults reported symptoms of depression in 2022. This shows how widespread the condition is. Depression is also linked to lower quality of life, difficulty working or studying, and strained relationships, which makes it an important public health concern. Depression matters because it can lead to disability and serious emotional distress. It also increases the risk of suicide, especially among younger adults. Depression affects not just individuals, but also families, communities, and the healthcare system. By understanding it better, we can improve prevention and treatment and reduces its impact. So, when we look at who is most affected by depression, we see some clear differences. Young adults ages 18 to 29 have the highest rate. Women also report more depression than men. Depression is higher among non-Hispanic white adults and people who identify as more than one race. And so depression is also connected to money and stress. People with lower income, people who are unemployed, or people who are going through financial problems are more likely to experience depression. These personal factors help us understand which group needs the most support. And so depression can also be different depending on where people live. So in the United States, the South and Midwest have the highest rates of depression. Rural areas usually have more depression than big cities. One reason is that rural places often have fewer mental health clinics, fewer doctors, and people may have trouble getting transportation or insurance. And understanding these location differences helps us see where more support and services are needed. When we look at depression trends over time, we see that the rates have been increasing since around 2015. The COVID-19 pandemic caused a major rise in depression, anxiety, and stress across all age groups. Younger adults experienced some of the fastest increases. This upward trend shows that depression continues to be a growing public health challenge. There are several key risk factors for depression. These include stressful life events, trauma, or major changes in life. Family history of mental illness can also increase risk. Chronic medical conditions like diabetes or heart disease are linked to depression. Social isolation, loneliness, and substance use are also important factors. These different risks can interact and make some people more vulnerable than others. Depression has a big impact on people and on the country. It is one of the main reasons people have trouble working or doing daily activities. It also raises healthcare costs because many people need treatment. And also, depression can lead to suicide, which is a major cause of death for young adults, because it affects people's emotions, their families, and even the economy. Depression creates a heavy burden on communities and society. So there are many strategies that can help prevent or manage depression. Early screening in primary care settings is important. because it helps identify symptoms early. Access to therapy and counseling can make a big difference. Medications may be useful for people with more severe symptoms. Reducing stigma around mental health is also very important because stigma prevents people from getting help. Finally, improving access to mental health services, especially in rural areas, can reduce the overall burden of depression. In conclusion, depression is a common and serious mental health condition among U.S. adults. Understanding the patterns by person, place, and time helps public health professionals identify who is most affected and where resources should go. More support, better access to mental health services, and early intervention can help reduce the impact of depression on individuals and communities.